This training session demonstrates how simple massage techniques can help relieve ankle pain, hip tension, and neck stiffness. Today, two sisters, Kelly and Jill, are learning practical family massage and practicing these techniques on each other under my guidance. My approach is simple. First, I demonstrate each technique, and then they repeat the movements while I observe and help adjust their positioning and pressure. Before we begin, it's helpful to understand Jill's history because it explains why we focused on specific areas. Over the past 20 years, Jill has sprained her ankle many times. Serious injury happened in November 2018 when she fell while running. She later had ligament repair surgery, and the surgeon discovered bone spurs and a significant amount of scar tissue. After the surgery, her ankle mobility was very limited. In 2020, she had a second operation to remove some of the scar tissue and bone spurs. Jill also experiences hip pain, which may be related to the long-term limitation in ankle mobility. You can see that her walking pattern has changed significantly over time. The goal of this massage is to reduce swelling, relieve discomfort, and decrease stress on the ankle joint. We use moderate kneading and gentle strokes directed along the natural lymphatic flow, from the foot upward toward the leg. I demonstrate how to control pressure and how to work effectively with the thumbs. Different areas of the foot tolerate pressure differently. The inner side of the foot can usually accept deeper pressure, while the top of the foot requires a lighter touch. We also carefully work around the heel and perform gently stretching of the ankle's muscles. I explained that placing a small pillow under the ankle can be helpful. When the leg is slightly elevated, fluid drainage improves and swelling can decrease more easily. After working with the ankle and foot, we move on to the thigh. I explained that direct pressure should not be applied to the hip joint itself. Instead, we work around the joint using circular movement with the hands, knuckles, or soft pressure from the fists, depending on the area and comfort of the person receiving the massage. First, I demonstrate the movements, then Kelly mirrors my work on the opposite side while observe and guide her technique. At the same time, we listen to Jill's feedback about the pressure and comfort. Jill reports that the sensations feel balanced and pleasant. In the second part of the training, Jill switches roles and begins working on the Kelly's upper body. I demonstrate the techniques and then Jill repeats them on Kelly's shoulders, neck, and head. Kelly often experiences tension in the shoulder girdle, especially in the neck and trapezius muscles, so our focus is on releasing that area. I demonstrate how to work with dense muscle tension using the thumbs instead of forcing pressure. The goal is to gradually follow the direction of the muscle fibers and allow the tissue to soften. We then practice gentle neck traction by lightly supporting the head. This technique helps reduce pressure in the neck and promotes relaxation. Next, we work on the scalp and the suboccipital muscles at the base of the skull. Small, controlled movements in this area can help release tension that often contributes to neck stiffness. Finally, I show how to work with the neck from the head position. It is important to avoid pressure on the vertebra and to be cautious along the sides of the neck, where major blood vessels and nerves are located. The muscles next to the spine respond well to small, gentle movements that help stretch and relax the tissues. By the end of the session, Kelly responds noticeable relief in her neck and shoulders. This practice shows that even simple massage techniques can be very effective when they are performed with proper pressure, good body mechanics, and careful attention to the body's responses. My massage training program is now open. If you have any questions, feel free to leave them in the comments below.